Hi students, today's lesson is about role of voluntary organizations and associations in elderly care. The government policy provides a broad framework for intersectoral collaboration and cooperation both within the government as well as between government and non-government agencies. The national policy on older persons recognizes the role of the NGO sector in providing user-friendly and affordable services to complement the endeavors of the state in this direction. The government continues its efforts to introduce programs for the welfare of the elderly. It is the non-government organizations which have played a key role in bringing to the forefront the problems of the older person to the society at large and through its various services. It has shown the seeds for a forum whereby the voice and the concerns of the elderly can be addressed. The lesson is about the role of voluntary agencies and associations in elder care. The purpose of the text is to discuss about the initiatives of voluntary agencies and associations working for elderly care. After completion of the lesson, you should learn one about the role of voluntary agencies in elder care and second about the role of associations or federations in elder care. The role of voluntary agencies or NGOs in the care of older persons has become important because central and state government activities and funding for the welfare of the elderly are limited. In fact, the government solicits active participation of the voluntary sector to meet the needs of older persons. The role of the voluntary sector in ensuring welfare to various segments of the population, including the elderly, has been emphasized in the 8th and 9th plan documents. The national policy on older persons announced in the year 1999 by the government envisages of promoting and assisting voluntary organizations for providing non-institutional services, construction and maintenance of old age homes, organizing services such as a daycare, multi-service citizens center, reach out services, supply of disability related aids and appliances, short-term stay services and friendly home visits by social workers. It was in the year 1983-84 that the government for the first time decided to make grants to voluntary organizations for services to the aged. The granting aid provisions is for number 1 rendering welfare services to the aged such as health care, income generation, subsistence training and the second one for constructing homes for the aged. Over the years, many NGOs have been supported from the budget outlays of the respective state governments, but with most state governments giving low priority to the welfare of the elderly and the low social encouragement given to the concept of voluntary care, vice versa family care. The provisions for grants has not been optimally used by the voluntary sector. Presently, there are many non-governmental organizations working for the cause of the elderly in India. In India, most of the non-governmental organizations have concentrated their work among the lower income group and the disadvantaged, disprivileged sections of the society. This is mainly because 1/3 of these populations are defined as capability poor, which means that they do not have access to minimum levels of health care and education for earning a decent living. Since the government is unable to deal with such a huge dependent population, it is the voluntary and non-governmental sector which has in the last few decades begun to actively work for the welfare of the lower income and dependent strata of society. Though the government has voiced official support for a larger role for NGOs and a number of voluntary organizations are active in the field of aging in different cities and regions at the national level and inputs remain limited. Various voluntary organizations working in India Following are some of the non-governmental organizations working in the protection and promoting of the interest of elder persons, providing various facilities, advocating the cause of aged population and acting as a pressure group, etc., are discussed below. The International Longevity Center India, ILCI. It is a non-for-profit organization working in the areas of education, training, research, media, documentation and advocacy for the cause of population aging since 2003. ILCI is one of the 10 members of the Global Alliances Network of the International Longevity Centers, including beside India, the USA, UK, France, Japan, Dominican Republic, Argentina, South Africa and Netherlands. The objectives of ILCI is to work towards promoting better understanding of the issue and concerns of population aging at all levels, including those identified by the United Nations in the Madrid and Shanghai plans of action, in collaboration with the government, the corporate sector, NGOs and the civil society, to seek adequate reflection of this understanding in all developmental plans and programs of the government and in non-governmental interventions and community actions, to promote and support all activities of upgrade the quality of life of population aging and ensure the fulfillment of their human rights, to work towards healthy, productive, participatory and qualitative aging. ILCI's primary focus is in the area of policy, training, research, advocacy and documentation. ILCI has carried out several research studies as follows: A. The demographic profile of the elderly in India. B. Human rights of the elderly, a study carried out in the states of Maharashtra, Uttar Pradesh and Orissa. And C. Crime against the elderly in Mumbai, Pune and Delhi. D. An evaluation of the implementation of the integrated program for older persons in Maharashtra and Gujarat. As part of its training activities, ILCI has designed a training course in geriatric healthcare for individuals who have studied up to 10th class and have attained the age of 18 years. This course would develop a cadre of trained personnel who could be caregivers for the elderly, thus providing the much needed specialized and trained personnel for geriatric caregiving. A book on this has also been published by ILCI. As a part of its advocacy component, ILCI has conducted several workshops on recreation and care for the elderly, minimum standard of living in old age homes, enabling devices for the elderly, an international roundtable on elder abuse, an international colloquium on the status of role of women in aging society, and a workshop on volunteerism of the elderly, beside many other workshops and seminars. ILCI is also the member of drafting committee for the state policy on older persons of Maharashtra. It is at presently engaged in a comparative study for the Government of India on the national policy on older persons of the two developed nations, Australia and Japan, and two developing nations, Sri Lanka and Bangladesh, and compares them with that of India. Silver Innings Foundation. Silver Inning Foundations is not for profit organization dedicated for the cause of elderly and their family members. The board consists of young and proactive professionals from different segments with a passion to work for the elderly. Its vision statement is an elderly friendly world in which aging becomes a positive and rewarding experience. Mission is to uphold and secure the rights of elderly and actively works towards improving their quality of life by networking, advocating, researching elderly issues and providing a wide range of services according to their needs. Silver Innings is a new beginning for elders. Silver Innings are committed to ensure that aging become a positive rewarding experience for all. aging gracefully is the way of life they promote. Silver Innings wish to help elders and their family members to overcome the challenges of aging and show them the way to live and dignity in their silver years. The 10 Commandments work for people above 50 years of age and their family. Sensitize community towards elderly issues, promoting research and development on issues related to elderly and aging, provide innovative quality services for elderly based on their changing needs and to utilize their experience and knowledge for the betterment of themselves and society. Actively work towards education, training of professionals in gerontology, geriatrics and geriatric care management, promoting lifelong learning and to empower the elderly, work against ageism and promote equality and human rights for the elderly, to initiate innovative intergenerational programs involving youth and elderly, to provide and promote home based and institutional services for elderly and the concept of successful aging, to advocate and lobby for elderly issues. On 10th April 2008, www.silverinnings.com was launched. The website is one-stop destination for all information with regarding to aging. Age Care India. Age Care India is a premier national voluntary organization for the welfare of aged people in the country. It appeared on the Indian national scene in January 1980. Supported by a group of dedicated founder members drawn from various walks of life and having diverse life experiences. It was formally registered on 18th November 1980 as a non-political, non-profit, secular, charitable, educational, cultural and social welfare organization under the Societies Registration Act 21 of 1860. Idea to float such an organization to promote the welfare of the retired and the aged people was originally conceived by its founder Mr. N. L. Kumar as far back as 1974 when the actual seed was sown, which ultimately blossomed into the present Age Care India aims and objectives to promote the welfare of aged people irrespective of caste, color or creed to lead a healthy, happy and dignified post-retirement life, to organize free geriatric health checkups, camps and clinics, to set up daycare centers for recreation and domiciliary services, to set up elder enclaves in calm, quiet and peaceful environs for simple, economical and functional housing with a package of amenities, to arrange spare time employment for fit and active retired people, to provide counseling and professional consultancy services for post-retirement planning, legal aid, housing and job cooperatives for self-employment, etc. To organize programs designed to provide for recreational, social, cultural and spiritual needs of the aged people, to establish skill bank for accumulation of professional expertise and knowledge dissemination for public good, to sponsor economically weak aged persons for institutional care, to set up a geriatric hospital and institution of gerontology for research and training in these new disciplines. The salient features of its objectives are to help the aged people in every possible way to lead a healthy, happy and dignified post-retirement life in reasonable comfort and peace. Membership wise, Age Care India has nearly 1500 members at present spread all over the country. Age Care India has very strong national patronage. It has also been recognized by the United Nations and its name has been listed in the United Nations Handbook of Organizations Active in the Field of Aging, 1988 edition, as one of the 270 organizations and educational institutions collaborating in the field of aging worldwide. The organization has many firsts to its credit. While it was the first NGO to start free geriatric health checkups camps in New Delhi for the urban poor way back in 1981, it soon spread its network in the rural sector around the national metropolis to provide much needed health care services to the rural poor, which were almost non-existent in the absence of any primary health care facilities then. Another important feature of Age Care India is the celebration of Elders Day regularly every year to honor senior citizens above 80 years of age. The first such celebration was held on 18th November 1981 and continued till date. Apart from this, the organization has also been the first to demand a national policy on aging way back in 1981 at the Age Care Seminar held on May 12, 1981 at the India International Centre, New Delhi. Soon after the organization launched its varied activities, they are an urban daycare center for the elderly, regular weekly public lectures on topics of age relevance and allied interests, counseling services, old age pension for the indigent elderly, conferences and seminars, surveys, essay contests for school and college students, declamation contests, placement of needy elderly in old age homes, etc., to create requisite awareness about the multifarious emergencies problem of the elderly. The organization is committed to uphold its gospel of growing gracefully to improve quality of life through a wide range of age caring programs and projects. Anugraha India. Anugraha, a national level NGO, is dedicated to the cause of alleviating the suffering and pain of the destitute and the neglected persons. Serving for communities in 4 states of India, it is registered as a society in October 2000. Anugraha was born out of humanitarian and actual field level experiences of a graying people. As an advocate for the well-being of the elderly persons, Anugraha is committed to providing forum for aging issues. All India Senior Citizens Confederation, AISCCON. AISCCON is the largest national organization to bring together and represent senior citizens across India. Today, AISCCON has federations, associations affiliated to it from 14 states. It is registered under the Societies Registration Act 1860 and the Bombay Public Trust Act 1950. Donation to AISCCON is eligible to income tax exemption under section 80G. Since 2002, AISCCON publishes a monthly newsletter named as AISCCON News. Through its columns, it is creating awareness among senior citizens and also informing them about development regarding senior citizens in India and abroad. It holds an All India Annual Conferences, National Conference of AISCCON. Nightingale's Medical Trust, NMT. Nightingale's Medical Trust is a non-governmental organization dedicated to elderly care. It firmly believes that elders should remain an integral part of their family. It works towards bringing joy, dignity, hope and health to their lives. It sensitizes the community and the government to the problems that elderly face and encourage public participation in their efforts to create various family based support systems for elderly of different socio-economic groups. Alzheimer's and Related Disorders Society of India, ARDSI. Alzheimer's and Related Disorders Society of India is the only national organization whose activities are exclusively devoted to help the victims and their families. Alzheimer's disease is a silent killer of brain and lives of world's elderly people. It is the 4th leading cause of death among the older adults in the developed world. ARDSI was formed by the team led by Dr. Jacob Roy, a pediatrician by profession, to improve the quality of life of the people with dementia, particularly to raise awareness of the disease. The main activities of ARDSI are to raise awareness, to develop services, to train family members and professionals, to undertake research. Society for Serving Seniors SSS. Society for Serving Seniors is a society set up in October 2006 to take up the cause of the senior citizens community as a whole. SSS is a society established for empowering, nurturing, informing and organizing responsible seniors. Empowerment may be achieved through advising on matters of financial security, facilitating exchange of information, knowledge or experience, help them organize as groups and uniting such groups into a pressure group, providing opportunities for learning new things, etc. Harmony. The Harmony for Silvers Foundation, founded in 2004 by Tina Anil Ambani, is a non-governmental organization working to enhance the quality of life of the elderly in India. It envisages India's elderly as silver citizens, glowing and proud. Harmony's mission is to create an environment where silvers, irrespective of their culture beliefs, can retain dignity, self-respect, pride and self-confidence. Since its inception till today, the foundation has accomplished the following: an interactive center for silver citizens in South Mumbai, Harmony the magazine, the Harmony Senior Citizens Run, research monographs, seminars, networking with like-minded organizations, advocacy. Dignity Foundation. Dignity Foundation, a popular and progressive NGO for senior citizens, promises avenues for productive living existence to the 50+ group. Headquarters at Mumbai, set up as a charitable organization under the Societies Registration Act of 1860 and also a public trust with Commissioner of Mumbai. Objectives: provide information to seniors through publishing, holding seminars and discussions, undertake various services for their support and welfare and enable them to live productive, meaningful and interesting lives, drawing upon their knowledge and skills and experiences. Construct a database to determine needs of senior citizens in India and devise ways to meet them. AgeWell Foundation. AgeWell Foundation's vision for older persons is to empower them to lead a life of dignity and respect. It believes sustained efforts would not only create older persons friendly environment, it would also awake a sense of responsibility amongst us all to make this possible. AgeWell Foundation seeks to reach out to larger audience of older persons and act as a catalyst of change in bridging the gap between generations and ensuring respectful and comfortable life for old people. AgeWell Foundation interacts with older persons and their caregivers to all levels, family, community and state. People Foundation. People Foundation is a human initiative by professionals from different walks of life, but like-minded individuals and sharing a common purpose to bettering conditions of the lesser privileged sections of the society. The People Tree, steady and dependable with its great branches spread wide in Pune, Mumbai, Lonavala, encompassed in its warmth and shelter, was the inspiration behind the name. Janaseva Foundation, Maharashtra, Pune. Broad areas of its services are health care, elderly care, disabled care, destitute care and education, training and research. Foundation is always involved in helping victims of natural disasters. Sahayog Foundation. Pune Geriatric Care Center is an outcome of the collective thinking of the professional social workers, social work teachers, psychiatrists, consultants and neurologists. In is an idea of providing emotional support and nursing care for the elderly people who are bedridden, suffering from age related illness, example dementia, stroke, etc., and elderly people who need attention but lack of family support. The objectives are to provide institutional services to the elderly people, to provide the care to the people with old age sickness, to provide physical and mental health services through the physio and yoga therapy. Non-residents Indians Parents Organization NRIPO. Many young Indians have moved to foreign countries for work, education or business, which results in their aged parents being left alone without assisting in daily living. NRIPO is working towards this goal by implementing certain programs including support service basic needs related to passports, visa and travel, medical insurance, medical aid, moral support to the aged and single parents of advanced age to make lives easier for the parents in the absence of their children. Hospital admissions for emergencies is made with local hospitals for priority and concessional treatment and admission without deposits. Despite the NGO voluntary sector coming forward to meet the growing needs of older persons, further steps need to be taken to create mechanisms for the proper and adequate delivery of services. There is an urgent need to expand provisions, strengthen capacities, balance geographical distribution, critically evaluate the functioning of different programs, involve the community in taking care of the aged and sensitize and conscientize the populace to the issues of aging. Equally, there is need to set up an apex or nodal agency to coordinate and synergize the different activities and programs as also network the various actors. Given the increasing cost of service provision, there is need to encourage resource sharing and promote volunteerism if society has to adequately respond to the diverse and multiple needs of our growing aged population.